Urine examination is one of the most important tests in clinical medicine. Unfortunately, it is one of the most ignored ones as well. I'm going to briefly tell you about what a urine test is and how to interpret that, and what are the different correlations between the different segments of a urine examination. Whenever you see a urine report, you'll see two kinds of headings. One of them is the macroscopic appearance of the urine, and the other one is the microscopic appearance. It often has the same variables. That means in macroscopic, we'll get appearance, pH, turbidity, proteins, glucose, blood, and leukocyte esterase. But in the microscopic one, this is done to confirm what is present in the macroscopic appearance. And that's when you look at the RBCs, you look at the pus cells, and thereby you confirm what is thought to be present macroscopically. First, we'll talk about these things, which are the macroscopic appearance. What does the urine look like? What is the pH, turbidity, and the specific gravity? Usually, you'll see them virtually in all of the urine tests. The macroscopic tests are often carried out by means of a dipstick. There are different kinds of dipsticks available. One of them is a universal dipstick, which shows all of these variables, and then you've got specific dipsticks, like for instance, which just show proteins, or the presence of blood, or just the presence of white cells. Macroscopically, when the lab assistant sees a urine sample, he will see the appearance, and he'll often note the appearance, that it's light yellow, or it's dark yellow, or it's bloody. The appearance, if you like to remember, there are 4 types of appearances which are counted as normal appearances. One appearance is the like a colorless appearance, just like water. As you would see, it is just like water. This is one appearance of the urine. The other one is lemonade colored urine. The third one is like that of mango, that means slightly darker than lemonade. And the last one is going to be something like an iced tea, so it's darker than a mango colored urine. So the appearance is going to be 4 different kinds of appearances, which are normal appearances. One of them is colorless. Second is lime colored. Third one, easy to remember, mango colored. And the last one is going to be something like iced tea color. These are the normal ones. But generally speaking, the lime and the mango colored urines are the normal ones, which you would expect in any person. A colorless urine, albeit it may be normal, but nevertheless it means that the urine is very dilute. Either the person is drinking too much water, or the person is actually having a chronic, some kind of a chronic renal impairment. The iced tea one is a darker shade. Once again, the person is probably not drinking too much water, is dehydrated, or it's actually heading towards a renal problem. For instance, somebody's got muscle breakdown, myoglobinuria, presence of blood, hematuria, etc. etc. But these are normally the 4 colors of the urine which you would regard as normal color of the urine. The pH of the urine is acidic. Think it's about 4.45. So generally between 4 and 5 is the normal pH. A pH of less than 4 is acidic, that's more acidic. A pH of greater than 5 is alkaline urine. This is the normal color. As long as it stays in this range, the person will unlikely have a urine infection and will unlikely have kidney stone formation. So the kidney stone formation will occur when the pH of urine is disturbed, that it's more towards the alkaline side. And likewise, if there are bacteria in the urine, they would want the pH to be to their liking. So they would want it to be an alkaline urine rather than an acidic urine. So in a normal acidic urine, it's unlikely that you've got a urine infection. The third one variable is turbidity. Turbidity, specific gravity, appearance, they can all interchange. Turbidity means whether or not the urine looks like normal or whether it is turbid. It's got certain things in it. that means it's got solutes in it, either it's got pus or it's got lots of solutes. So the urine appearance will be turbid. So if you've got a urine, turbid colored urine, it means that either there could be underlying infection, which you'll prove from these different parts, or if it's normal turbidity, then it means that it's a normal colored urine. Lastly is the specific gravity. The normal specific gravity ranges between 1.10 to 1.20, but we have to 1.020. But we have to remember that in the specific gravity of water is 1.010. So if the specific gravity of the urine test is 1.010, it means that either somebody's got chronic renal failure or they're drinking excessive amounts of water. If the specific gravity is higher, 1.020, that's a normal specific gravity, and you would expect the specific gravity of the urine to be in this range. So these are the four appearances: the appearance, pH stability, and specific gravity, which give you generally a rough idea as to what to expect in the remaining parts of urine test.